Mark Newman, co-founder and CEO of Nomi Health, leverages his tech background from founding HireVue, which was sold to Carlyle in 2019, to drive healthcare innovation. Nomi Health connects providers directly with employers, offering fixed-rate services like checkups and vaccinations at no cost to employees, aiming to cut healthcare spending by up to 30% by eliminating traditional system waste. As of last October, Nomi announced a partnership with CareSource, a managed Medicaid plan that supports over 2 million lives. Their services include direct contracts, pharmacy benefits, analytics via Artemis, and community care targeting self-funded employers, providers, and governments. Newman also spearheaded Nomi Health's COVID-19 response, notably with testing programs like Test Utah. Mark, thanks so much for joining us.
Thanks for having me.
We're talking about you're just down the street here in Utah, just about 5 minutes away from our office, which is incredible. We'd love to hear about what was your motivation to start Nomi. In a previous life, you founded and ran HireVue, so maybe just talk to us about that.
For sure. So my background seems to be that HR is my tribe, and I just hang out with employers all the time. I was fortunate. I grew up in Canada when I was a kid and moved to Utah, and had moved here on 3 weeks' notice. Had no idea what Utah was. Had only been to the U.S. once in my life, and next thing you know, we moved here, and thought I'd be here for a few years, then start college, and decide to start HireVue while I'm in college. So I went to Westminster up the road. And in our lifetimes, like, you always try to search and create meaningful work, right? In terms of what you get to do. The summer before I started HireVue, I did animal shows at Hogle Zoo. So that wasn't my path, to kind of do that for the rest of my life. But we got to build HireVue, which was AI and machine learning and video-based job interviews for organizations, right? Like that people weren't profiles, resumes, or anything like that. Their stories, ideas, experiences. Like, let's help people tell their story and transform how companies build teams. What that meant was that, I got to be at the forefront and have people follow us into the dark around transforming how you recruit, and which you guys have done an amazing job on here. And, then life happens in funny, mysterious ways. Like, you think you're going to build a business for a few years, you end up building it for almost 15. You start planning, and kind of getting to that point where, you've raised money from all the top VCs, you've done all the things that you thought you're supposed to do, you start selling the business, and then life happens in funny, mysterious ways. So my son was born, and I was in Timpanogos Hospital just down the road, and this lovely person comes into my room, says, "Congratulations on your new baby." I was like, "Thank you. Who are you?" And she's like, "I'm from finance. I'm here to talk to you about your bill before you leave." So my HR team had got me ready for this moment, right? I was like, all right, because, in life, your first time really experiencing healthcare is probably like your first kid, right?
Yep,
or
yep.
some accident, or doing something stupid, right? Hopefully. And I sat there and I was like, great. And I was like, okay, what's the bill? And I got just given this mumbo jumbo of like, "Oh, we worked with your insurance company on a flat bundled payment and a this and a that." And I said, "What is it?" And she's like, $4,500. And I said, "Great." And I give her my payment card, and she's like, "What do you want me to do with this?" And I said, pay the bill. And she's like, "Well, I could introduce you to one of my payment plans," and all the stuff that we hear about, right? Because it's so hard for providers to get paid. And I go, wait, what if I just pay the whole thing? She's like, "I'll take 30% off right now." Wow. And I sat there, and this was like one of those funny situations, right? Because I was stunned and I was pissed because I had just gone through like a 15% rate increase at HireVue for my benefits that year. And I showed up with money and I got a lower price. Right. Like, and so that went counter to like a kind of a base problem, right? That I was having this massive rate expansion and I showed up and I got 30% off. And I was fascinated by this when I probably should have been focused on a different life experience that was happening right that moment. But second, because of my experience building HireVue, we did almost all the hiring for all the major insurance companies. And I was able to go talk to them and said, "Hey, this just happened. Could I be a pilot and like do something like this?" Because everyone in healthcare seems to think healthcare problems are unique to healthcare. That was a good old fashioned business problem, right? Like, let me go solve this. And they're like, "That didn't happen. Get out of our office." And I was like, okay, that's weird. Then who else would be really upset about this? Because I'm really upset about this. Oh, wait, all I've done is hang out with HR people my whole life. I'm going to go talk to them. So, that was kind of this funny convergence of going from talent acquisition to employer benefits, because HR is HR, right? And that's who I hang out with. That's who I want to support. That's who I partner with. Because if we can transform the employee and family experience related to your company, whether it's the job that you give them or how you support them while you're there, like that's how we make magic happen. So, that's Nomi.
Wow.
And and Nomi today is the operating system for self-insured employers to take back the system to be their own and rebuild healthcare at, we think, at least 30%, if not half the cost.
Yeah, it's incredible. I think you guys have one of the most unique business models that I've seen, and I think both of us have. One of the things about your guys' direct contracts is you try to reduce the patient expense as much as possible, right? So as little copays, as little deductibles as possible, and really should be little to no cost to employees, right? Which if I'm an employee, that is incredibly attractive to me, right? The other side of that is overutilization, right? And if there is no barrier to go and actually get healthcare, then for any small inconvenience, I'm going to go to the doctor's office and be like, can you help me? Because I know my employer is going to cover it. So how do you think about striking a balance? And is this something that you come across?
Yeah, for sure. I have 3 kids. There is literally no extra time in our life to like go conveniently to the doctor anytime you want, on there. But outside of that, for our model, it's really simple. Like we do take an approach of no copay, no deductible healthcare, because we want to keep providers in the care business and get them out of the collections business. Like that's like why you're here. It's like, how do we keep our providers doing what they're supposed to be doing and not dealing with BS issues that this industry creates for them, right? Second, we benefit from focus. So our world is wholly focused on self-insured and I'd say working age healthcare, right? So if you think about working age healthcare, that's, your team members inside of your organization, right? And the people that we interact with every day. So that isn't as much, Medicaid, Medicare, individual, marketplace, full risk, whatever. It's like self-insured, working age healthcare. What breaks your plan isn't if you go to the primary care doctor or if you go get mental health or if you go get physical therapy. Like that's not what breaks your plan. What breaks your plan are cancers, NICU babies, ridiculously overpriced medications, car accidents, ski accidents, right? It's like the big things that, none of us plan for or want more of. And so what we found is that, when we partner with our employers, we take them on this journey. 1, know your data. So like actually know what you spend your money on and where you spend it. And then 2, cut the spread. Because as you guys know, like $1 of negotiated healthcare in America is, $1 to nobody else, right? It's like, it's about $1.20 to $1.30 to the employer to even access it. And your providers are collecting 80 cents on the dollar, 70 cents on the dollar, 90 cents on the dollar at best in terms of what they're doing. So how about instead we say, how about we pay you right now, get you out of the collection business and access what we call the real price of healthcare? And so between knowing your data and cutting that spread, it's about a 25-30% savings. What you'll find from a utilization standpoint is there's like a 6 or 7% give back. That 6 or 7% give back, though, isn't more cancers, more NICU babies, more this, more that. It is more primary care, more mental health, more physical therapy. And it's like the things that you actually want. And so the value prop's pretty big, right? Like your employer is usually experiencing a 10 to 15% annual increase. We are now taking down their costs 15 to 20%. They have a no copay, no deductible plan that they're offering to their team members, which makes them an employer of choice. And maybe people go get a bit more healthcare that they should be getting that we want them to get. We're good.
Well, and especially on the maintenance side, right? Like a lot of times that's supposed to be included in depending on the specialty. I'm a little biased. I'm a physical therapist. So I'm happy that we're creating opportunities for patients and employees to get access to services like that. But underutilization on that side is huge.
Totally.
And I wonder,
you have a high deductible health plan and you're like, am I going to pay $180 every physical therapy appointment 100%. To go? No, I'm going to just put it off. Maybe go once. And then something bad's going to happen. It's going to get way worse.
Well, then the irony is, of course, they're not as healthy as individuals, right? And they're less effective as employees because they do have more health problems because they're too scared to go spend on the plan. And then ultimately it harms the company more than helps them, because it goes full circle because their employees aren't healthy.
It doesn't matter if you're a white collar worker, a blue collar, a physical labor, a knowledge worker, whatever you want to call it. If your back hurts, guess what? You're not doing your best work and living your best life, right? And it's stupid. Like, we have this system that we keep putting, deductibles and co-payments and whatever on a population of people that like can't afford it.
Yeah.
And, and you think, oh, that's going to, limit utilization. Well, no, what it actually does is drive providers out of business. And if we drive providers out of business, then they have to price in the risk of non-payment, and then they have to do this, and then they have to do that. And so rather than trying to address the complexity, how about we just get rid of the stupid and, and simplify this entire thing?
That.
That's why you guys do what you do and what we do. I do.
Exactly.
Let's go solve this thing.
So, following up on that, if direct contracts with a tech backbone, tech layer like you guys have, they take over, right? We see significantly more penetration across the market. What are some of the most seismic shakeups you see coming from the existing legacy healthcare infrastructure's biggest players?
I don't know. The fact that 20 years ago, none of them existed in the Fortune 100, and now 20 of them exist in the Fortune 50. Maybe that's not good for America when our healthcare costs have gone from $2 trillion to $5 trillion. Like, if we can save 30% of US healthcare spend, that is $1 trillion, and at some point will be soon $2 trillion a year of cost that Americans and families and employers don't incur. What could we do with an extra $1 trillion in our pocket every single year? We could quadruple pay for teachers. We could have every road be paved twice. We could have modern infrastructure everywhere. We could have free broadband, free internet, free cell phones, free, you know what I mean? Like, you name it. It's $1 trillion freaking dollars.
Yeah.
And we just act like, well, that's healthcare. And so for us, it's like, no, we absolutely need to disrupt and change this system. It is putting America out of business. And I do think there's going to be the organizations who try to maintain an existing model and the ones who accept that it's time to change.
Yeah.
And we don't know, we can't name them all right at this moment on who's going to do what, but we know what the side we want to be on. And that's going to be the side of the Rebel Alliance, not the Empire.
I love that analogy. We actually have a graph in our office which shows different industries and the non-inflationary increase in prices over time. So basically accounted for inflation. And healthcare is basically number one in terms of the admin bloat and a lot of the bloat that you speak about. And if you look at things like smartphones or digital tech, it's actually one of the groups that has decreased the most in price.
Stock trading.
Yep.
The cost of moving money has not gone up. It has gone down.
Yep.
Right? Like, but we're working in an industry where it's 60% paper check. And we think, oh, well, or like stupid things like payment integrity. It's like, how about this? How about pay it right the first time? Like, JP Morgan isn't calling you saying, hey, I think I paid this restaurant wrong. Can I get my money back? Right? Like, American Express doesn't do it different. Like, when you book a flight, it comes up with rental car, hotel, show tickets, weather, you name it. And because when you swipe a credit card, it goes through 400 plus systems in 3 seconds. Yet for some reason, we think it's okay to take 2 to 9 months to finally decide if you're going to give the privilege of paying a doctor that delivered care to somebody you're responsible for.
A doctor that went to school for how long?
Yeah, exactly.
Then took the risk of owning a practice, then did the quality care, and then had to pay someone to go work for 2 to 9 months to even maybe get paid.
For sure.
But probably not.
Yeah. Let's run restaurants that way. Let's run schools that way. Let's run every other business in America that way. Or, maybe just maybe we should have healthcare run like everything else in our life and have some money back in our pocket. Absolutely.
So I want to move to this CareSource partnership because I think it's fascinating, and it's one of the places we've worked together as a partnership between our two companies. For the listeners, CareSource is a nonprofit managed Medicaid health plan with 2 million plus members. And they selected Nomi and Nomi Health Nexus to actually partner with it in October. And correct me if I'm wrong, but it's since expanded to additional states as well, which is incredible. The goal is to launch a new comprehensive effort to help close the gaps in healthcare access and outcomes. We started in Ohio, Georgia, and Indiana, and we've expanded since. First, congrats on that. I mean, that's a pretty big deal. It's been a lot of fun working on that together. I want to start with Talk to us about what Nomi Health's focus on low-income communities says about the future of health equity.
Yeah. Everything we do, doesn't matter if it's analytics, payments, direct access for medical, pharmacy, gaps in care, you name it, is focused on one customer. And that is any American in their family that makes less than $100,000 a year, because they are healthcare poor at this point. Right? Like it doesn't matter what the plan is that they are on. They are one bad medical day away from devastation in their lives. And in this environment, we're doing trade-offs of interest payments, mortgage rates, food, you name it. Let's stop having it be healthcare. And so there are organizations out there that are doing something about it, and there are others that put their head in the sand. And CareSource is one of the do something about it. They're fantastic. And what they realize is that it isn't necessarily easy to go and look, if you looked at your own workforce inside of the organization and you asked what percentage of people inside of this team have access to a primary care doctor, we would probably think it's 70 to 90%. Mm-hmm. And I bet you reality is it's a third.
Wow.
Right. It's this kind of cognitive dissonance of what we believe versus what's actual. Right. When did our team members all go to basic appointments, or when, or new moms, are they getting the support that they need? And we're like, of course, but they actually aren't. Right. Yeah. And this is what CareSource recognized and said, well, this has to stop. Right? We support people who, are on Medicaid plans, whether it's temporarily or permanent or a long-term, we have to figure out better ways to bring healthcare to them rather than healthcare, rather than them to healthcare. Yeah. And we have to solve this, because if we can handle the basics and we can do the basics better, it turns out the outcomes are massive. Right. And Nomi as an organization, so you mentioned our work during the pandemic. We went from, 10 people in January of 2020 to, thousands working for us every day. We served 17 million people through the pandemic, wow. being the public health operator for all sorts of states and counties across the country. We get pulled in phone calls to support, I'd say, really gnarly problems that at really high scale that don't have a place that fits in the traditional system or model, right? So COVID did not fit in the traditional healthcare model, right? And gaps in care is another interesting environment, right? Because you've got 2 million members. You want 60% of them, having primary care visits or something, and it might be 20%, right? Or it might be this, or it might be that. And you're like, oh, what should we do? I don't know, randomly create massive amounts of new primary care doctors and appointments and networks and this and that in this geography, which is not a plausible answer on any short time frame. So who do you call? Well, you can't call your primary care clinics, and you can't call your health systems, and you can't call other payers, and you can't call this. And somehow, some way, Nomi's created a brand where it's who are you going to call? It's Nomi, right? And we just get pulled into these really interesting, gnarly problems where we need to go figure out how to go do something 500,000 times, right? Or 1,000,000 times, or this or that, to solve this problem. And it was just a real great match coming together with organizations like CareSource, and there's others kind of coming down the pipe that and again, gets this crux of there's so many people that say you can't, healthcare is what it is and you can't do anything about it. And there's organizations that say you can. And that's just, how we want to roll.
Yeah. And we feel very fortunate in the partnership as a result, and sort of the ability to grow together. I want to turn to the Artemis acquisition that you guys did, because I think that analytics are at the core of everything that we do in terms of how we make decisions, in terms of the transparency we like to give to doctors and practice owners about how are they running their own business, right? And sort of as do you. How do you think the data tracking there could encourage health plans to rethink their approach to delivering personalized primary care?
Oh, this will be a good one. I mean, what's funny about it is it's 2025, and we did this acquisition back in 2021. Artemis was quite small. We've more than quadrupled the platform lives on. We're about 17 million lives on the platform today. 1,400 plus employers, from large enterprise on down to small towns, cities, unions, and everyone in between. And it goes to a core question: as a CEO or a CFO, what do you spend on healthcare? And it's still shocking to me how many CEOs or CFOs I can meet with. And I bet you half the time a CEO knows, half the time that those people know, they know maybe medical and pharmacy. And then you go, no, stop. On what? What do you spend your healthcare dollars on?
Right.
And they're like, I have no idea. Like what drugs, what places, what facilities, what doctors, what conditions, what problems aren't you paying for that you should be, right? What are those things? And they're like, I have no idea. It's a black box. And so everything we do and focus on from our data with our data platform is to break open that black box. What do you spend your money on? Where do you spend it? What should you do differently? Now, employers having access to data on their healthcare spend is frankly new, right? It's been considered especially pre-COVID, it was considered a privilege to get data from a payer, about your healthcare spend. But now we think it's a God-given right? And like that you can get your data and do what you want with it. And what we've seen emerge out in a post-pandemic era was that, you had so many healthcare decisions focused on being driven by benefits leaders. That coming out of the pandemic, you have CEOs, CFOs, governors, mayors, you name it, who had to basically stand up their own health system through the pandemic, come out of the pandemic and then say, I can't unsee what I had to do, right, to kind of go and address this.
Yep.
And so we think the next frontier of using that data and insight to transform things like for advanced primary care, chronic care management, drug spending, right? It's like you could go to a $200 specialist appointment and inadvertently walk out with a $60,000 prescription and have no idea, right? Kind of on these pieces, is using that data to drive both real-time data, real-time payment, real-time action. And so it's got a core to everything that we do. It's like like I said earlier, in our personal life, you book a flight somewhere and it comes up with a rental car, hotel, show tickets, weather. In our healthcare lives, you should go to the doctor. That person should get paid, and we should figure out next step and do it right now. And that's core to what we do.
Yeah, it's amazing. It's amazing. I'm a little biased here. I practiced 10 years in Utah. Oh, awesome. And my wife is currently practicing here as well. So knowing that a company like this is here locally is amazing, number one. Number two is I just love the idea of challenging a system or a paradigm, right? That healthcare cannot be changed. And number two, like seeing it happen so quickly. Like that is very fulfilling. And that's a hard thing to find in a career, is to see true impact on a community, especially your local community. So I'm assuming, again, I'm thinking this like, wow, that is a very inspiring workplace to be in. Does that help mold kind of how you choose? You come from recruiting. How do you find this workforce to support this type of a movement? Is it a certain profile that really likes to make a difference, like in their own communities and see change? Like tell me about how you choose that profile. Yeah. Well,
building Nomi has been hard from a team standpoint, right? Because there's an unending list of people that exist in this industry that show up with a bias or how this industry is supposed to work. Right. And we have this balance of in industry and out of industry, right? So for us, it's really important, one, that everyone has a healthcare story. You have to have you have to have a reason and you have to have either an understanding or a reason about why we do what we do every day. And it could be, I have family members that are struggling with this. I have, I was a physical therapist that decided to save myself, right? I changed my life. I deal with this cost. I deal with this thing, whatever it might be, right? That's first. And second, everyone has their values. Ours is like you act like an owner and you take charge and you take action, right? And you go do it. And third, like you have to stand for something, right? And for us, I won't say the state, but we're in a state right now dealing with a situation where a payer that owns 70% market share thinks that it's okay to both jack up rates for every employer and have provider income go down. And like you can see these stats, right? Like you can see provider income going down and rates kind of going up, and they're like, well, that's healthcare costs. And we're like, well, that state is now not open for business. Meaning like no employer's building there. Right. No school district can maintain teachers in the classroom because their benefits costs are going up too much. No manufacturer is going to add jobs, right, on this part of it. And so we decided to go partner with all those health systems and say, listen, it's time for something new. And we went in there, and it wasn't about, volume of lives for price and this and that you get from like that traditional healthcare model. Yeah. We went in and said, no, it's like, it's time to solve this problem. And if we solve this problem, we will have teachers in the classroom, we will have manufacturers and workforces building here again. And we will have a great place to live because people can afford their healthcare. And they all came in. And, we've cut healthcare costs for these employers 20 to 30%, and net revenue go up for those providers. So what does that payer try to do? Pay their bills? No, they're trying to legislate us out of existence, right? Kind of on there. So it goes back to the talent that you have on your team. You need people with backbones that stand for something, that are going to go do it. We are going to go take action on this problem. Like if there's a hurdle or a door, we bust it down, right? And you do it, and you don't do it without like people having to like pound the table to say, go do that, go do that, go do that. It's just innate, and when you know it, right? And you bring it in.
Yeah. I love it. I think the similar to your story, I think the people that we see doing really well here are people that are just super hungry, super mission driven, and will run through walls to get whatever needs to done, because the industry moves so slowly. I mean, for every single thing you try to do, there's 5 layers of pushback. And to your point, it's the people that put their head down and say, you know what, we're going to get through this. That's what you build around, right? And so I think, I think we can resonate in many ways there.
It's like there's 2 core truths when it comes to talent. It's like, one, when you're building an organization, there will always be fires. Like you will never live in a world where there's no fires. So you need a kick-ass firefighting team, right? Just like you'd have to know that like as an organization, when a problem erupts, we go address it, right? And that's what our customers and partners want. And second, it's like the old kid story. A weed is just a plant planted in the wrong place. And so like you guys are, in the RCM world or in the EMR world or in the scribe world or you name it, right? If you think about like investment banking, an investment banker at Goldman could be great at Goldman and terrible at Raymond James, right? Or like be great at Raymond James and terrible at this. And like and you have to figure out like what's the essence of like who's successful here, how we're successful, how we think about it, and and how to get people to like that fit, right? And like where they're not a weed, that they're the plant, and go do it.
Yeah. I love that. I have some stats for you, just closing the loop on CareSource. When we look at differences in rural and urban rates of different metrics, because I know that's what CareSource is really focused on, the rural side. So if we look at in Ohio, the percentage of adults who had a flu shot in the past year from the Department of Health, 45% rural, 50% urban. If you look at in Georgia, percent of children up to date on vaccinations between 19 to 35 months, 65% rural, 75% urban. And that's from the Department of Public Health. And then if you look at in Indiana, the percentage of adults who had a routine checkup in the past year, it's 69% rural, 74% urban. So, I mean, we're seeing clear differentials here. And so my question there is, what is Nomi's Health?
And I think those are their best stats they picked.
Those are the best.
If I'm just going to, like call. Exactly. I think those are their best.
Their best stats.
Yeah. Because as you guys know, reality does not reflect that. Right.
Maybe it's some cohort of the data or something like that. But, what is Nomi's Health in patient education, right? Because a lot of this, of course, is providing the care, but it's also telling people. We saw some stats on mammograms, for example, right? Hey, you have to get a mammogram at age 50 or something like that. Just in terms of letting the more rural communities know, here are the right things to do at different parts in life. Yeah,
I mean, rural and urban is like an interesting divide because and rural really has to be like small town rural. Does that make sense? Like, because like if a town loses their town doctor, like the town's dead. Right. On there. We see like the disparities that we spend most of our time focusing on really is income, right? Because that is the what do you think? Like the great stratifier, right? In terms of access, in terms of treatment, in terms of primary care, in terms of shots, vaccines, you name it. And it's getting worse every single day. So like our obsession isn't rural urban is one thing, but income demographics is so massive in its effect on access and getting care. And so in our world, that's what we focus on. And in many cases, when you talk to Sarah Ratner, who runs our integrated programs, right? The feedback we get for the people we serve is that this is the first time in their life someone called them to say, we have access for you. Versus like trying to navigate and figure that out. Because like the 3 of us, if we want to go to the doctor, we can go today. We can go tomorrow. We can pick whatever venue we want to, right? It could be virtual. It could be in person. It could be ER. It could be urgent care. It could be a buddy. It could be a concierge. It could be a primary, direct primary care, whatever it is. Like we have to walk in the shoes of people where that is not an option. And even if they can get an appointment, That doesn't mean they can make it there. That doesn't mean they can have a car to get there. That doesn't mean they can take work off to go to it. That doesn't mean like life isn't in the way and stopping them from being able to go get it. And so, yeah, for our world, it's focused on demographics, and it's like, and the feedback resoundingly is this is the first time someone's ever called to say we have care.
That's powerful.
That gives me goosebumps.
Yeah.
So it is the great travesty of the system, right? Because the system is run by a whole lot of people where we're like, well, yeah, if you need healthcare, go get healthcare. Right. Oh, you need a drug? Like it's a $10 copay? Like just go pay it, right? And it's like, no, that's a problem in a lot of families in a lot of situations, and we have to walk in those shoes.
Not a lot of empathy going on in that type of a model.
Yeah, I mean, like when you're, and that's what we really try to drive forward with.
That's awesome. I mean, like I said, a lot of personal bias interjected here, but equality, right? Just accessibility across different demographics is so impactful. So do you get to hear from these groups that you're contracting with, employers, when you give statements like that, right? This is the first time anyone's contacted me to have the opportunity to have care. Like, do you get to hear those stories often? And so, like, can we hear a couple of those stories?
Yeah, I mean, it's the benefit of not being built in the 70s or 80s or being paper-based is that you actually do get that feedback, right?
Yeah.
And you are part of it, right? We, universally, whether it's like the clinicians on the phone with people doing gaps in care, like we want to understand what's going on. We want to be recording those calls. We want to be learning from it. We want to be gleaning from it. Stuff that like all of us kind of say, of course we do this, right? Like, kind of doesn't happen there. So we see that routinely. The nice part about having 17 million lives on our analytics platform is like, we want to ground spend in fact and truth. So if like spend, access, utilization, you name it, so much around digital health is like hope, right? Yeah. Oh, if we just do this for this population of people that happen this way, maybe we'll get you an ROI. And we're like, no, let's drive measurable changes or results on this. And so on a regular basis, oh, guess what? Like here's a huge casino company that we took their pharmacy spend down 22% year over year when it was going up 20% a year. Oh. And then we absorbed a 25% increase in lives and utilization and kept it flat, and people were like, amazing. So I just got all the drugs I wanted, that sounds terrible. I got the access to the pharmacies that I wanted and needed, pharmaceuticals I wanted and needed as part of my care plans. I closed gaps in care. I went and did this, and I was actually able to do something about healthcare costs. So
that's awesome. That's awesome. And like you said, I love the statement, like stand for something, right? I'm assuming that the connection of standing for something and then hearing those stories to reiterate like what they're standing for is making a difference. Do you see like that taking action description you had earlier, the profile of people you're hiring? Do you see that coming full circle, like feeding into it? So when they show up with a backbone, they take action, they see positive results, and that just reinforces their drive to grow something great together.
Yeah. It's really fun building a company when you're on the right side of the argument, and you show up every single day, and you do great work, right? Yeah. And so scale begets scale in that regard, and we go after it.
That's awesome.
I had a couple questions in terms of just running big businesses. HireVue, you were running at scale. Nomi, we're just speaking about, you have about 500 employees, 17 million lives. You're running these big care source contracts. And there's probably a lot you could solve, right? Just your team and the strength of your team. How do you ruthlessly prioritize, right? I think especially for the folks listening that may run their own business or run their own clinic, or, it seems like you could work on 50 things at once if you wanted to. Just curious your framework.
I mean, you guys have never dealt with this in your organization. You're 3,000 people and you have this feeling no matter what, like ultimately people that are entrepreneurial, whether you're a single provider that decided to go into practice for yourself to, wanting to transform how billing and payment happens in healthcare to how access works or you name it, like you're a little nuts. Like you're a little like, you didn't just say, I want to go like join this path and work your way up, and kind of go down there. Right. You might've had one career choice and then changed, right? Yep. Kind of down this path, being a physical therapist or whatever. And so you're kind of wired a little differently anyways. And you naturally have this mentality of like, I can do anything, right? On there. But it's like you nailed it. It's like, what should we do versus what you shouldn't do?
Yeah.
And, it's so hard. and it is constant, right? And it is that kind of both ruthless prioritization, it is focus, and it doesn't mean like micromanagement in this. It's like, just try to keep like a framework of what are we working towards, what we want to deliver on, and how do we go do it, and then like let that creativity go, right? Because products are going to iterate and expand, and when you pull an EMR and RCM and Scribe together, you don't quite know what it's going to pull off yet, right? And so you don't want to say we only do these 3 things and we don't do anything else. It's like, well, no, what do these 3 things unlock? And it's a constant battle because you naturally think you can do anything and you want to go solve everything, right? And then you have to figure out what you're really good at and where you've earned the right to play and to go win there. And then not break it, not break all the goodness of what got you there, to kind of keep driving it. And it's so hard. I haven't figured it out. So if you guys figure it out, just let me know.
well, I think we're working on it.
It's in the process.
I think we're working. I think one guiding North Star for us, we were speaking about a little bit before, is we're just, you're customer obsessed. And I think we have one of the mottos, or one of the values we have, is the day doesn't end until the customer is happy. Right. I think a lot of the ways that we've built products is we take the customer feedback, right? You talk about this bundle, you talk about some of the other products we're working on with patient engagement and things like that. We had customers say, hey, it would be awesome if you guys had this. And we're like, okay, well, if we hear it enough times,
right,
your prioritization is kind of there for you, right?
Oh yeah. And you got to those things. It's like, it's actually really, really, it's so easy to build a shitty company. Does it make sense? Like, it's surprisingly easy to build a crappy company. It is really hard to build a great one, right? That customers actually care about, that you want to partner with, that people want to work for, right? That you can have enduring economics to be to earn the right to stay in business. And for me, it's like, all right, you deliver new innovation that people didn't think was possible. You drive massive adoption of that innovation, and you earn really passionate customers. And it's like, and if you can do those 3 things, you have your best shot at having an enduring company, right? There's going and doing it, but it's funny. We measure it sometimes on what are the weird things that we got asked for, because sometimes if they think that you're their natural partner in problem solving, the weirder the request, you're like, we've earned something here, right? And what happened last fall when the hurricane hit North Carolina, right? And when Florida reopens after a hurricane in 48 hours, they're like, hurricanes are not a thing anymore in Florida. Kevin Guthrie that runs FDEM, Governor DeSantis, they're incredible at handling hurricanes. But they hit North Carolina, right? And people in Western North Carolina, which is really rural. And out of nowhere, we got phone calls from local leaders and the governor's office. And they were like, so Nomi, so this just happened. What can you do for us? And we're like, what? And we're like, have you called the person to clean up debris? Have you got dumpsters? Have you figured out water like this? And they're like, we don't know who to call. And we're like, why are you calling us? And they're like, because these other governors told us to call you.
That's
and
incredible.
I was like, wow, that's net promoter right there. Because we have no idea how to help you get water treatment going and debris cleanup and whatever.
That's incredible.
But we've kind of learned these things,
incredible.
Right? Or Sarah was running reentry programs coming out of prisons. We had no background in that, but we just knew this process had to be an experience that had to be a magical moment for that moment in that person's life, right?
Yeah.
And reentry for somebody coming out of jails or prisons when they were on mat therapy and other things was being run 5-year-old soccer. It was I'm dependent on this medication to not kind of start using again and to not end up back in prison. So, okay, fantastic. See ya. Where do I go get it? I don't know. Maybe you have to enroll in Medicaid, or do you know what a PBM is? No. Fantastic. Well, they'll totally go to CVS. I'm sure they will totally, give you these. And you had to hope on charity that a pharmacist would sit there and be like, no, let's help you out. Right. And they would try their best, but the program wasn't built for effectiveness here. Right. Yeah. And we just looked at it and said, this can't be 5-year-old soccer anymore where we cheer when people hit a goal and this. It's it has to be a world-class relay team. Right. We have to have the data. We have to go do this. You have to execute it this way, kind of go pull it off. You guys replicate this over and over in your business. And it's, and magic can happen, when you do it right.
I love that story. That's a good place to be. So
we had no idea how to get debris removal or water filtration or dams rebuilt or whatever.
The fact
we told them who to call, but the fact that we got that phone call was amazing.
And it looks like you helped them out, right? You guided them in the right direction.
Let us know how that goes.
No, that's incredible. It's incredible. I want to move to predictions. So, what is your boldest prediction about primary care and digital care across the U.S. in the next 5 to 10 years, and where does Nomi sit in that picture?
I have a bull and a bear case.
Okay.
The bear case, and I hope to God it doesn't happen this way, is that it's the exact same. Because there's an entire industry of players that want it to be the same. Right. It's like, and we are dealing with this. Like, you guys have been building the business now for 8 years?
8 years.
Yeah. 8 years on this. And you're like, the pace of change is incredibly rapid. And then you look at healthcare and you're like, sort of, like
except there.
Check volume went from 60% to 48%. This is huge. That's like, the Wells Fargo wagon going to, being an actual bank account. And so like the bear case is that it's the exact same and we have to keep navigating through this, right? The bull case though, one of our board members, Chris Klomp, just became head of Medicare, right? On this, and you got Drew, who's running Medicaid out of Mississippi, and you have the new leader of CMMI. It's like that you actually might have and with Oz, running CMS and RFK running HHS, that you now have a team of people that are like, no, we're changing this thing, right? And you may not agree with all the changes and the models and the methods and this, but man, it's kind of nice having a team that's going to go fight for change, right? And kind of go do something about it. Well, what does that solve in the next 4 years, right? And you're seeing a lot around whether it's real-time payments, real-time data, gaps in care identification. How do you think about fraud, waste, abuse? You name it. And it's like, let's support the team that's trying, right? And like, let's kind of go do this. And so I think the bull case is that people are fed up. We've seen it right over the last 6 months in healthcare. People are fed up. That means that like the population is ready for something different. Employers are ready for something different. And I think governmental wise, whether it's blue, red, state, federal, everyone knows there has to be something different. And so I think you'll see, digital access first just being the norm, because like, why was telehealth so innovative? Well, for the first time, doctors could get paid to talk to you on the phone. It wasn't fancy. It's like, that seems like we can solve some real problems if we just make it simple to access. That you actually, as an employer and as a member, own your data and can like do something about it and understand it. Even if you're an expensive patient, doesn't mean like whether you're an expensive patient or a cheap one, right? Like own your data and kind of see something with it. It should all be integrated into one place. Like you guys are doing really cool stuff on the scribe side and understanding that and getting that nuance. Well, like what can you do with that and what can you learn from it? The idea that like EMRs don't talk to payment systems, that don't talk to HIEs, that don't talk to this, that don't talk to that, and then like gets paid with a paper check. Like, I don't know. I think we can do better. And then, AI and machine learning is going to be fun. Like one company I'm involved with called Videra Health does check-ins, are like a lot from our experience at HireView. And you can pick up personality change, cognitive change, suicidal ideation, and all sorts of other metrics caused by interactions on medications or other problems, and like have an air traffic control system that supports and protects patients, that like reaches out automatically to say, hey, like your language has changed. Maybe you're like going into a manic episode. Like, let's go and support that. I think we're just scratching the surface on what we can do. It's going to be a lot of fun.
Wow. And we're excited to build it together. So I want to move to a segment where we talk about just having extra time in your day. And, one of the things that I'm curious about is, and of course we've been working together, so it's a little bit of a different scenario, but, if your staff say they had to deal with zero insurance, zero documentation, zero admin tasks, right? Assuming that, we move to this model where a lot of that isn't necessary, or it's automated, 100% automated, which is what we're moving to. How do you think their quality of life would change, right? Because you mentioned yourself, it's tough to get the right type of people, right? But this is one of the roadblocks.
What's our burnout and turnover rate on America on physicians? 30%,
something like that.
Or,
it's high.
It's ridiculous. And do we think that's from serving patients? Or do we think that's from them realizing I became a doctor and it turns out that I get to be a debt collector. I get to prescribe care actions for people who don't have the means to be able to actually like do them or adopt them. I know the problem's right in front of me, but they can't even have like a nurse come to their house to help them. Right. It's like frustration and apathy and annoyance and bankruptcy, frankly, of them trying to stay into it. And I think we can do two things if we can transform, there's healthcare, right? And we all have this, like when we say healthcare, we all picture in our mind that magical moment in our lives where like you get the care that you need or that family member gets the care that they need at that moment. Well, that's the delivery of healthcare. Behind the delivery of healthcare is the business of healthcare, which is the worst operating business in the world is U.S. healthcare, right? It makes no sense how it operates and works. Except that there's an enormous number of people that make money extracting rents from making sure that it's this messed up. And so if we can fix the business of healthcare, it turns out we can totally fix the delivery of healthcare, right? So if we can give a provider back 20 hours a week from billing and justification and paperwork and this and that, do you think that they'll save 5 to 10 hours for themselves? And and I guarantee they give 10 to 15 hours back to more patients.
Yeah.
So then we solve the access problem, right? Kind of on this. Or we talk a lot about Medicaid. If in Medicaid, we can drive like real-time payment, same-day payment, total efficiency, on this. And it turns out providers would say, yeah, I'll see more Medicaid patients. So it's not about rate. Like we outsourced a lot of Medicaid to really poorly performing organizations. And so you have low rate, high administrative burden, slow payment. So do you see Medicaid patients? No.
Yeah.
But if you have that same low rate, low administrative burden, immediate payment,
right.
maybe you'll see more Medicaid patients. And rather than hoping that primary care increases 40% in America, we can improve efficiency 40% in America, and we have way more appointments, right? So I think if we can fix the business of care, we fix the delivery of care.
I love it. And it's just the same idea. I mean, in my personal view with my life experiences, right? Like I thought the solution was just go do cash pay to get away from the system, right? But then I'm only treating this, not even 1%, that's like 0.5% of the population that can afford that. And the people that I really want to make an impact with is exactly those that couldn't access it in the first place.
Yep.
So if no one wants to just face the problem as a whole and make some type of impact, really the burnout's never solved for us as providers either. Yeah. Because now we're actually treating a subset of the population we care about them. We don't want to say that, but we want to treat a full representation of the demographic that we live in.
Again, like you don't come out of school and you're like, you know what I want to do? I just want to support people that all make above $250,000 a year, deal with like golf injuries and problems like that.
It's usually non-compliant if they know more than you.
Do this part of it and like see them in the neighborhood and at the country club, right? It's like, ideally that's like almost what people run to because they're like, I'm so frustrated with trying to stay in business.
Right.
That's why you see like concierge medicine, direct primary care, all these kind of various things, right? But really what they're trying to do, like the problem they're trying to solve is I want to deliver care, not deal with BS trying to figure out how to get paid for it.
Right. Right.
And if you're like, okay, why don't we do that for all healthcare?
Yes.
And then all of a sudden, like, in general, you go into healthcare. I mean, there's mercenaries, but most of them are missionaries in the sense of like, they're there to support people and take care of them and like want to have that fulfillment.
Right. And shockingly, suddenly burnout goes down. Yeah. Right. You're probably working just as many hours. Yeah. But you're actually impacting lives.
It's fulfilled. Yes.
Yes. Because you have fulfillment because you're serving a population that didn't have access before because of groups like yourself. Yeah. So I get super excited. This has been super informational for me, and I love your guys' mission because it solves a lot of the core issues that I personally dealt with being a provider and why I don't currently practice full-time. You're taking it on like just head on. And I don't know very many groups that have tried to do that, let alone at, your guys' rate with this type of success is pretty inspiring for me.
Thanks. I always think of it as like the last Star Wars movie, right? Where you have like that planet and you have all the same evil empire ships that all look the same and they rise out of the planet and the Emperor is there. And then the Rebel Alliance shows up and they're all different looking. Different ships, different styles, different teams, different people, whatever. Like it's not going to be one company that changes healthcare, one organization. It's going to be Nomi and Athelis and this and that. And we all come together as the Rebel Alliance to go change this thing. So let's go do it.
Let's go do it. I love it. I love the Star Wars. This is amazing.
Absolutely. Well, we're very grateful for your time and for you being here. And thanks so much.
Thank you.